basically, well, if you think about it, everybody's working on points. You know, people are working on trigger points, tender points, densified points, and you go to get a massage, and they'll be working on some points. You tell them where it hurts, et cetera, et cetera. And it's really interesting to me that a man by the name of Luigi Stecco, who is a physical therapist and has been studying fascia for like 35 years, been working on these same points, I guess, that everybody else has. And he started to realize over time that there were particular points that maybe were more important than other points. And he actually found out that most of the points that he had been working on before he even knew about acupuncture, that most of them were acupuncture points too.
Mm-hmm.
And the interesting thing about acupuncture points is they are in the fascia. And so he, through the years, I mean, I think he's on his 7th textbook now. He started to get information and develop something which is called fascial manipulation. And the interesting thing about it that really stirs me is that the points are related to function. In other words, if somebody says it hurts and somebody goes on a point and works on it, oh, fine. You know, it may help, of course, but what if you were able to do a functional test? What if you were able to have the neck and move it in a lateral bending, and they laterally bend to the right and they feel pain on the left? What if there was a particular point related to just that lateral bending? So, or maybe resisted testing on your arm in some manner. Maybe there's particular points, or you do resisted flexion or extension of your wrist. So, in other words, what he's done is he's correlated functional testing with these points. And he has a theory about what these points are and how they should be treated. And because he's associated with the acupuncture system, he's divided the body up into fascial planes. For example, you know, you'll have a sagittal plane, anterior, posterior, or horizontal, internal, external rotation, or frontal, medial, lateral. So you actually go through an examination with the patient, checking these planes, seeing if there's weakness, pain, whatever, and determining, well, which sequence am I going to treat? And the beautiful thing about it is you decide on a sequence because you'll decide on it after, well, let's say I took my arm and I kept it straight and I pushed against resistance because I have pain maybe in my shoulder. You might, if that is positive, you might go to the shoulder area at a particular location, and you would see if that point is densified, is it sensitive to the patient, and many times you'll go to a point not even near the patient's complaint. Like if you did leg extension and you were testing, say, the quadriceps, and maybe they had patella pain, usually the point would be somewhere in the middle of the thigh between the vastus lateralis and the biceps. And the patient doesn't know about that point. You go to that point, and they say, wow, is that sensitive? And you'll feel it's very densified, and possibly it may refer to the knee. So you'll work on that point. And not only that point, but because that's called an anterior point, you might want to work an anterior point by the hip, an anterior point on the leg, treating that sequence to free up the fascia along that plane. So he's sort of brought, I don't know, I always say he's brought Eastern and Western medicine together somehow. You know, it's like he picks on these particular, and it's interesting, the most important acupuncture points appear to be the ones in the deepest connective tissue, in the deepest part of the fascia.